Pelvic fractures. The incidences of pelvic fractures is on rise nowadays because of the increased number of road traffic accident. Now this fracture is not a serious management problem in itself, but the visceral injuries associated with it makes it a complicated one. These fractures can occur in any age group, but the most common are the young adults, and that is because of the road traffic accidents. Some important landmarks. As you can see here in the image, the pelvis is made up of three bones, ilium, pubis and ischium, together with the midline, sacrum and coccyx. Anteriorly, the bone meets to form the pubic symphysis, as you can see here, and posteriorly with the sacrum to form the sacroiliac complex. Now, these structures collectively form an imaginary. This ring is very important, especially when there is an injury or fracture to the pelvic bones. Pelvic fractures can occur in any age group but are most common in young adults. About 2/3 of all the pelvic fractures occur in road traffic accidents. As we have already discussed why these fractures are on rise nowadays, and the contributing factor is the road traffic accident. This is not a serious management problem in itself, but the visceral complications, the visceral injuries that is associated with this fracture makes it a difficult one. Injuries commonly associated with pelvic fractures are, the first one is a severe blood loss. As we all know that blood loss occurs from the major blood vessels during the injury to the major bones like pelvis or femur. In case of pelvis, the blood loss is around 1500 ml to 2000 ml. And this might lead to hypovolemic shock. And this hypovolemic shock is the commonest cause of death following fracture of the major bones such as pelvis and femur, if not corrected timely. Third condition is the sepsis. And fourth is acute respiratory distress syndrome, ARDS. Now this acute respiratory distress syndrome is a sequel of major trauma, and this causes the release of inflammatory mediators which can disrupt the microvasculature of the pulmonary system, and patient develop tachypnea and labored breathing. If you get the chest x-ray done, you will see there will be pulmonary infiltration. This condition should be managed properly, and in this case 100% oxygen and assisted ventilation should be given to the patient, and it takes around 4 to 7 days for the chest to get clear and the patient returns to the normal life. Now, fracture in the interior half of the ring may have an associated injury in the posterior half, and this makes the pelvic ring unstable. As you can see here, the fracture, as here it is shown with the green color, in this region might affect the structures which are present posteriorly like the sacroiliac joint on both the sides. And this also affect the pelvic ring, the ring that is being formed here, that will also become unstable because of these injuries. Classification of pelvic injuries. Pelvic injuries are classified into three categories: type A, type B and type C. Type A are stable injuries. They are further subdivided into A1 and A2. A1 includes the fracture that not involve the ring, like the avulsion injuries or the iliac wing fractures. A2 are the stable injuries or minimally displaced fractures of the ring. Now, when we talk about the type B injuries are rotationally unstable injuries, but they are vertically stable. They are subdivided into three types: B1, B2 and B3. B1 is an open book injury because of the external rotation. B2 are due to the lateral compression, ipsilateral side, and B3 also the lateral compression, and that will lead to the bucket handle injury. Now type C are both the rotationally and vertically unstable injuries. They are further subdivided into C1, C2, C3. C1 unilateral injuries, C2 bilateral injuries, and C3 associated with the acetabular fracture. Now here are the type A injuries which are stable in nature. In this type of injury, the pelvic ring is stable and displacement is insignificant. Here there is a fracture of the iliac wing and the pubic rami. In this case, fracture of the pelvis not involving the ring, and this ring here depicting the stability of the ring. So here the ring is intact and stable. There is a fracture only of the iliac wing and the pubic rami. A2, this is an stable injury. There is a minimally displaced fracture of the ring. Overall stability of the ring is maintained as depicting here. Now type 2. These are rotationally unstable and vertically stable injuries. So pelvis is unstable here, although there is no vertical displacement. External rotation forces usually act on the hemipelvis. As you can see here in B1 open book, it is a unilateral one. Here there is an injury only to half of the pelvis, because of which there is an opening at the region of the pubic symphysis, and see the ring here, there is an opening in the region of ring also. So this occurred due to the external rotation of the hemipelvis. Now in B1 open book bilateral type, here there is an external rotation on both the sides. It is a bilateral injury, so both the sides sacroiliac joint are affected. Along with that, there is an injury in the region of the pubic symphysis, and the gap is more compared to the B1 unilateral side. See the opening here or in the ring, it is more compared to this side of ring. Now B2 are the lateral compression injuries. This is lateral compression ipsilateral side. Now see the ring here, how much disruption is there. There is a SI joint involved and the pubic symphysis region. So there is a rotational instability. Now in B3 again there is a lateral compression injury, but it is contralateral side. Opposite sides are involved. So here the SI joint, there is no involvement of the pubic symphysis as such, but the other structures near to it are affected, giving it a look of a bucket handle. Now see the ring here, it's giving a look of a bucket handle. That's why this condition, this injury is known as the bucket handle type injury. Now type C injuries. These are the most unstable injuries, the essential feature being vertical instability. So these are rotationally as well as vertically unstable injuries. Now as you can see here in C1, they are rotationally and vertically unstable. See how much vertical displacement is here along with rotational one. So it is depicting here also in the ring that half of the ring is moving up, vertically unstable as well as rotationally. Now in C2, because bilaterally the changes are occurring, both the pelvis are being displaced from its position. So overall stability of the ring is maintained here because the changes are occurring on both the sides. In C3, there is a vertical and rotational instability along with the associated acetabular fracture. So you can see here the ring is disrupted. There is a vertical and rotational displacement along with this fracture in the acetabular region. Now let's discuss them in detail. Type A injury, isolated fractures. As we have already discussed that in type A injury, the pelvic ring is stable and displacement is insignificant. So ischiopubic rami fracture is a very common example of this type of injury. One or both the rami may be fractured on one or both the sides. So one or both the rami may be fractured and they may be fractured on both the sides. Is bilateral on both the sides. That condition is known as the straddle fracture. Minimal displacement occur. There may be associated injury to the urethra or bladder. So we should look for the sign of the urethra or the bladder injury. Patient with multiple injuries may not have any complaint referring to this fracture, and it is usually detected by the routine pelvic compression test. So in case of multiple injuries, always perform the pelvic compression test. It is only when we perform the pelvic compression test that we detect this kind of fracture. Radiologically, we should carefully rule out any associated fracture, especially in the posterior half of the pelvis, because if there is an injury in the anterior half of the pelvis, it might result into the injury in the posterior half of the pelvis. So always look carefully. It is only when this is done, when we carefully rule out the X-ray and see for the anterior and the posterior half injuries of the pelvic ring, Then only we can make our diagnosis or confirm our diagnosis that this is an isolated pubic rami fracture. Now comes the treatment. These fractures usually unite easily, union is successful and they pose no problem. Bed rest should be done for 1 to 3 weeks and treatment for the relief of pain should be done. Iliac wing fracture. This is relatively an uncommon fracture. As you can see here, it is an isolated iliac wing fracture. It usually results from the direct injury to the wing, and as we have already discussed that these fractures are encountered during the road traffic accident. So directly if something hit in the region of the iliac wing, it will result in the iliac wing fracture. Sometimes patient lose too much blood from the vascular iliac wing that it results into hypovolemic shock. Otherwise, this fracture is not associated with any complications and unite easily within 4 to 6 weeks only with rest. Now, avulsion fractures of the anterior inferior iliac spine. As we all know, the straight head of the rectus femoris muscles take its origin from the anterior inferior iliac spine. Now these are the anterior inferior iliac spine on both the sides, and this is the rectus femoris muscle which takes its origin from this point. Sometimes due to the violent contraction of this rectus femoris muscles, which is especially occur during the jumping or fast running, there is a strong contraction, and this contraction pulls off the anterior inferior iliac spine along with it. As you can see here, a strong contraction of the muscles sometimes chips off the anterior inferior iliac spine along with it. So fracture unites easily, quickly within 3 to 4 weeks without any complication. Acetabular fractures. These fractures are usually undisplaced or sometimes displaced minimally. They usually unite without any complication, but there are chances of secondary osteoarthritis in some cases because of the damage to the articular structures following injury. Type B and Type C injuries. Now these are rotationally unstable and vertically stable injuries, Type B, and Type C are rotationally and vertically unstable injuries. These are uncommon but important injuries because these injuries are associated with complications, and in these injuries you will often see that there is a disruption of the pubic symphysis. Road traffic accidents are the commonest cause, and if we see the pathology, then a portion of the pelvic ring is broken and there must be a fracture or dislocation in another portion of the ring. As you can see here in the diagram, there is a displacement and rotation and moreover disruption of the pubic symphysis. Other than that, the structures like the ligaments and the structures that provide the stability, the ligaments also get injured. Displacements. Displacement is slight and it depends upon the forces causing the fracture. Different type of displacements can occur. Here is the list of the displacements that can occur, mainly 4 types. External rotation of the hemipelvis, the open book type. Internal rotation of the hemipelvis. Rotation superiorly, which is the bucket handle type, and vertical displacement. Now the external rotation of the hemipelvis, the open book type. Here the pelvic ring is opened from the front like a book, and there may be disruption of the pubic symphysis or the rami fracture in the front, and there might be injury to the sacroiliac joint behind. As you can see here also in the image, due to the external rotation there is damage to the SI joint and the disruption of the pubic symphysis. Now here in X-ray also, due to the external rotation there is a damage to the SI joint and the disruption of the pubic symphysis. Next is the internal rotation of the hemipelvis. Internal rotation of the hemipelvis usually results from the lateral compression forces. They may overlap anteriorly with or without the posterior lesion. This shortens the diameter across the pelvis. There is a little risk of vascular or the ligamentous injuries. There is a decreased volume of the pelvis in this type of injury. As you can see here in the X-ray also, there is an internal rotation of the hemipelvis, and this occur due to the lateral injuries. It may be unilateral or bilateral. Rotation superiorly, bucket handle type. Here, the hemipelvis rotates superiorly. As you can see here, there is a fracture in the sacrum as well as in the region of the pubic region. There is a fracture throughout in the horizontal axis, and there is a complete superior rotation of the hemipelvis. Here is an X-ray depicting the same. Vertical displacements. This results from the vertical forces causing upward displacement of the half of the pelvis. Now here half of the pelvis is moving upward. So there is an injury in the region of the SI joint as well as the pubic symphysis. Both the X-rays are depicting the same thing. The SI joint is affected as well as there is a disruption of the pubic symphysis. Now clinical examination. Pelvic fracture are major injuries, and often these injuries has no clinical obvious deformity. So must be carefully looked for in all the cases of the road traffic accident, especially in those where there are multiple injuries or the patient have major lower limb bone fractures, or there might be hypovolumic shock. So in case of the major lower limb bone fractures, or if there is a hypovolumic shock, or there are multiple injuries, we should carefully look for pelvic fractures, especially of the fractures that occurs due to the road traffic accident. Next thing is the pelvic compression test. Pelvic fractures are often diagnosed when the doctor perform routine pelvic compression test in an individual who met the road traffic accident. So pelvic compression test can be performed by the doctor to see if there is any form of injury in the region of pelvis. In a displaced pelvis fracture, there may be shortening of one of the lower limb. So if a patient is reporting to you with an injury and the lower extremity, one of the lower extremity is shortened, then always look for the pelvic fractures. Limb may lie in the attitude of external rotation. Palpation sometimes reveal a localized tenderness or crepitus that will lead to the diagnosis of these injuries. There might be gap at the region of pubic symphysis, and you can feel that gap occasionally. The patient might complain anesthesia or weakness in one leg because of the injury to the sciatic plexus. And due to the injury to the sciatic plexus, there might be anesthesia or weakness in one leg or both. Patient may be unable to pass urine. High energy fractures are extremely serious, as we all know, and they are often associated with the visceral injuries, sepsis, acute respiratory distress syndrome, and mortality rate is considerable in such injuries. Investigations. Routine X-ray should be done. AP, lateral and oblique view. As you can see here, this is an AP view, this is the lateral view, and this is an oblique view. Oblique view is usually done to see the acetabular fractures. There are some spatial X-rays that needs to be done in case of pelvic fractures. This is the inlet view or the outlet view. This is an inlet view. In inlet view, we can easily see the vertical and the horizontal fractures and displacement along with SI widening. In outlet view, this is an outlet view, sacrum fractures and SI disruption is usually seen in the outlet view. Other than that, for more detailed information, CT scan is the scan of choice. This is how the inlet and the outlet views are taken. Treatment. First and foremost is the correction of the hypovolemic shock, because hypovolemic shock might lead to death. So timely correction of hypovolemic shock is very important. At the site of fracture, if possible, temporarily stabilize the fractured area with the help of external fixator, as it is useful in reducing the hemorrhage, and take the patient to the higher center where the definite treatment of the hypovolemic shock will be done. Patient should be moved as little as possible, because this might lead to the movement at the fracture site, and this may further result into bleeding or fat embolism. If there are associated injuries, and usually these injuries are present, then we should treat them first. An injury with a minimal or no displacement. So what should be done? First is the absolute bed rest for 3 to 4 weeks. After that, gradually starts the mobilization and weight bearing. It takes around 6 to 8 weeks for the patient to be up and about and perform his or her daily activities. In case of injuries with the anterior opening of the pelvis, like the open book fracture, if the opening is less than 2.5 centimeter, treatment will remain the same as in case of minimal or no displacement fracture. But if the opening is more than 2.5 centimeter, then the reduction is the treatment of choice. Reduction is usually maintained by one of the following methods. The first is the plaster spica. As you can see here, a spica is applied in the region of the pelvis with the opening for the defecation and urination. This should be avoided in early patients. Second, hammock sink action can be given to the patient to maintain the reduction. Other than that, external fixation or internal fixation can be done. So this is how external fixation and internal fixation is done to maintain the injury. Injuries with the vertical displacement. Now, treatment for the vertical displacement injuries is difficult. These injuries are difficult to treat. Treatment usually done by the bilateral upper tibial traction. In most of the cases, initially 20 kg weight is applied. 20 kg weight is applied, and after 3 weeks, the weight is reduced to half, that is around 10 kg, and then the patient is mobilized after 6 to 8 weeks. Now the complications. As this fracture is associated with lots of complications, so first is the rupture of the urinary bladder. This rupture is usually occur in the fracture of the pubic rami or the pubic symphysis disruption. This rupture is usually extraperitoneal. Urine usually extravasates into the periviscal space, and patient complain that he or she is unable to pass the urine. In such condition, catheterization should be done. It is usually possible to catheterize the patient, but usually few drops of the blood stained urine comes out. The definitive treatment is surgery. Second is the rupture of urethra. It is common in wide separation of the pubic symphysis of the pubic rami fracture. Diagnosis may be made by the cardinal signs, and the cardinal signs are blood per urethra, perineal hematoma, and the distended bladder. For this condition also, surgery is a treatment of choice. There might be injuries to the major blood vessels. Rarely common iliac artery or one of its branches may be injured. And to restore the continuity of this common iliac artery, surgical repair or the vein grafting is the treatment of choice. Injury to the nerves. In case of major pelvic ring disruption injuries, especially with the vertical displacement of half of the pelvis, lumbosacral plexus nerves are often injured. As you can see here, this is the pelvis and how the nerves passes through this region. So in case of major disruption, there is an involvement of one or two nerves. So treatment is usually conservative. Recovery occur in some cases, but in most of the cases, recovery is irreversible and consequent paralysis is permanent in most of the patients. Rupture of the diaphragm. It is a very rare injury and occur in very severely displaced pelvic fractures. Patient often complain pain in the abdomen. Patient might find it difficult to breathe properly. And treatment is the surgical repair of the diaphragm. I hope you like the video. Kindly like, share and subscribe the channel, and keep watching, keep sharing these videos.